Welcome. Come with me. The doctors will see you now.
So welcome back to another episode of Fast Talks with Family Docs. I am Dr. Phil Palmer.
And I am Dr. Viravadala, and we're back with Dr. Owens and Dr. Owens. As Dr. Palmer nicely put it last episode, we're talking about their both respective fields in family medicine, their training, and what it's like to be a father and son duo in this field. So speaking of you guys both being in the field and you know, when you get together and meet up, do you talk about cases and bounce ideas off of each other? I know we were talking about this a little off air, but I think the listeners would be interested to know.
Guilty as charged. In fact, that's what we were doing so late.
That's awesome.
That's right.
That's good.
So, two heads are usually better than one. I mean, we usually live by that one too.
Plus in 3
That's
cases
right.
from home to here.
That's right.
Yeah.
But yeah, absolutely. I feel like, I mean, of course, you know, I think we've kind of joked about the practice of medicine earlier. I feel like that's absolutely old true. I think if you ever go, and then especially in family medicine, I think none of us are too bold as to think that we have, you know, every route down, you know, up to date, just imprinted on the back of our brains. And so I think making sure that you know, get a chance to run things by, get perspectives that aren't your own, hear from people that have had additional clinical pearls and things to share that they've seen across their career. I mean, that's obviously as a seasoned veteran, he's had a whole lot of those to share. And of course I have, you know, just little things here and there that I've seen too, but yeah, absolutely.
Well, and it's reassuring, as you said, to get wisdom from somebody else who may have seen something you haven't seen. It's also reassuring to have a trusted colleague go, I have no idea either.
That's right.
Absolutely.
That's also true.
No, it's like I you know, like on social media, sir, and I see these influencers and people that run med spas saying, I'm an expert in this, this, and this. And I'm like, if you don't have that thought process of wanting to learn more and bouncing ideas up, that's scary.
Absolutely.
Right? Medicine's ever changing. And
That's right.
we're always, I think we have to be willing to learn.
Absolutely. Absolutely. And you have your own additional perspective to share here, having your brother not too far down the road who's got a lot of additional insights.
Yeah,
so.
but he's internal medicine, so our thoughts aren't always aligned. We're disagreeing about my dad's blood pressure all the time.
That's neither here nor there.
No, yeah, but no, it's yeah, obviously it's great to have that, like you guys shared. I think,
Absolutely.
I love my brother for my listeners.
Of course. That's all right. Let the record reflect.
So I'm curious, is there any particular thing that you've learned from each other, either related to the practice of medicine, related to leadership, related to your approach in teaching, anything you've picked up from your dad?
Yeah, I mean,
Thomas.
I'll definitely lead out the gate with that. We're in the middle of discussions about exactly that right now. I think especially when you kind of first fledgling graduate, and if you're kind of a high anxiety, you're a little OCD, you want to make sure you don't miss any of the things that I've just tried to cram into this brain for the last, you know, X years. I think sometimes, especially working on things like, how do you flow through a clinic day? How do you manage the burdens of documentation with patient facing, making sure they still get the full, you know, visit experience, making sure that you get follow-ups and continuity with them, and follow up with them. That's also still not just like I'm at home charting for 3 hours every night. I think finding that balance is also another thing that my dad's been able to share a whole lot with me. And I think that's probably something a lot of people go through, especially in the first few years out practicing on their own. But that's, I think, another really big example was not just even, of course, with the medical, you know, knowledge bank itself, but also even the practice of medicine, like you're implying. I think that's something, of course, I'll continue working on and learning from, but remembering to kind of stop and smell the roses and realize the things you can address and things you'll have to continue working on with your patients, that they appreciate you more in that moment, being fully present, and then knowing where to set your boundaries so that you can kind of keep doing more for them each time you do see them.
That's excellent. That's excellent. And Dad, my similar question for you. I know we had a brief discussion on the last episode of how much you've seen in your son and how capable he is as a man and as a physician. What have you picked up from him? Is there anything that's invigorated you at this point in your career, seeing him as he's starting to practice?
Absolutely. Well, let me first start by saying that now that people ask me, are you Dr. Owens' father? And when I say yes, invariably I said, well, he's so tall. Excuse me? And so well, of course, he's tall and handsome. after his mother.
There
Like
you go.
all the members
There you go.
of Thomas's mother
right.
family are
4
tall,
6 foot.
handsome people. Yeah, everybody in my family is short.
But we remain seated this entire interview, so they'll
They'll
never know.
Exactly. But actually, yes, and we just were talking about it in the break. Um, I came from my fellowship, joined a practice as a group practice all along, and then eventually at Great Plains, which is even closer knit practice. Thomas practices mostly alone. He ended up inheriting a practice of a doctor that suddenly passed away, had a ton of patients. So from day one, he had an explosion of patients. So for him to be able to adapt to that is something I never experienced. So actually, I'm learning from him, watching how he does that.
Yeah.
We have a more limited practice and a faculty in the place that we are. And we always have somebody around to bounce things off, which is the case at the Health Sciences Center, but not at the private practice where he's at OU Edmond. So I am at all what he does with all that. And then you're new, right? So your ability to control things, to maneuver things. So he bounces that off of me a lot, What do you do when you told the assistant 3 times? It's like,
Absolutely.
Yeah.
you just look up. I always give him some wishy-washy answer.
Nature of the beast, though.
He also, of course, has areas of expertise that are beyond me, with all the sports medicine and everything else. And more importantly, if I show up at the Thunder organization, they won't even give me the time of day unless I say, I'm Dr. Tomás Owens. They'll let me right in.
That's the key to the door. There you go. There you go. Tomas, I'm curious from what you've seen of your son, and I know that you got to be around a lot of his peers as he was in medical school as well as in residency. What is your perspective on the future of medicine, seeing the generation that's coming into practice now? What have you seen? How they're engaging healthcare compared to where we were 30 years ago?
Well, I tell you, I'm a little bit of a countercurrent on that. That typically people our age has similar common statements. Oh, the millennials. They don't want to work.
Yeah.
They're always on the computer, etc. My take is that the generational differences are not so much by the name, like millennial or whatever, but just age related. I think when you're younger, you're more impetuous. When you're older, you're a little, maybe more thoughtful a little bit. I see this generation as being as emphatic about learning the art as we were.
Yeah.
Work as hard or harder as we do.
Yeah.
And some of the adjustments that we've made are not necessarily a bad thing. In fact, they're not a bad thing, period. Having a little more time for family is absolutely
It's a
essential.
good thing.
Having a little more time to recycle your brain, although you and I don't do it perfect, but it's a lot better. And I think they have a more comprehensive view of the world than we did. I mean, we caught up with it with the older generation, but it's second nature to them.
Right.
When I was in school, medical school in the early 80s, well, I didn't know what people were doing in Thailand.
Yeah.
These guys can tell you what they're doing anywhere in the world
Right.
at the top of their hand. So I think there's a lot to be learned from a new generation. They learn from us as well. They should, but we learn a lot from them. And I'm at awe of the way that Thomas juggles his life. By the way, he's a much better father than I was. You have to
Not
see
sure
it with
those
his kiddos, Violet and Patrick. He's just tremendous. And to have that ability to balance all that and to practice medicine at the level that he does is just extraordinary. And I do know because he asked me things, so you're exactly right. Exactly right.
Well, sir, I had a follow-up statement I was going to make, but then you brought up Thomas's kids, and I forgot it. So that's okay, because it's adorable.
I
and-
say we do the rest of the episode on
I know.
Fantastic.
You two put
There
up
is not
pictures.
enough time, ladies and gentlemen.
But you could. I
Okay.
remember working with Thomas and the way he interacted with kids. You know he's going to be an amazing father.
You're way too kind, Dr. Vidal. Per usual, you are.
No,
you
Dr.
fit out of
Owens,
here.
I can't talk.
That's
Dr. Owens, I love you, but I love your son. I'm so sorry. He's really cool.
That's a
You are
very
too
standard
kind.
statement about every day.
All right, so
Anyway,
it's second time. I gotta keep this thing going. But you guys, you both teach. You're both mentors, and everyone speaks so highly of you as educators. I recently had a chance to work with one of your residents, Dr. Jacob, and she says like, "I love Dr. Owens." You know, so you know, what do you guys ever talk about that aspect of your job? Do you have different teaching styles, or do you bounce ideas off of each other? How to deal with giving feedback for a student or a resident, or how to teach a procedure, etc.
Yeah, I don't know that probably as explicitly in that way, but I do think one of the things in general that's come up a lot is kind of how you approach the day to day, and especially how you approach like conflict resolution, especially in team settings. Because I feel like that's a lot of, especially when you guys are when we're tending on services. There's a lot of dynamic between if you've got medical students on, if you've got of course your interns, second year, third years are on, kind of what it looks like. Okay, I'm checking someone's I have phone call. I'm not in person, but I got to get this information from them. How do you navigate the confidence of what you're doing? What degree of looking over the shoulder do you think you need? What time of year are you doing that kind of stuff? And of course, some of that I'm sure you just kind of get with time. But I think definitely we've also been, I've had a chance to watch and learn. I think a lot of that too. So probably had like conversations peripherally about it, but I've just seen so much of it too. And we always say some of your jokes about like, what do you think? Yeah, all right. Are you sure? Okay, good. So you joke about it. Just pick up the phone and say a couple of those. But in all reality, definitely like watching him help like residents come to conclusions over the phone. I think that's something hopefully I've been able to instill a little bit of in my own experience as an educator or preceptor to this point.
And I've watched him when he's been home. He's really skilled at doing that. We haven't, like, I agree with him. We haven't spoken a lot about that aspect of the teaching part, but we share more about specific patients. But he's extraordinarily good on the phone with the residents. When it adjusted to age, I think I wasn't as good when I was his age. It took me a little longer, but definitely then I'll bounce him off or whatever. And that joke we do have.
That's right.
You have to be a doctor, be attending. Isn't it?
Right.
Yeah. What do you think about that? Have you looked that up?
Yep.
You sure? There's nothing else to
sounds good.
That's right. A few random statements.
No.
There's a lot of truth in that. So you've both already commented as to how your fathers influenced your careers. But I'm curious from each of you, were there mentors outside of your family that played a significant role in your progress through medicine and helping you to be in the position you are and the leader that you are?
Let me say right away, we're staring at one right here in the flesh.
Well,
So
you're too
obviously,
kind.
is the truth of it. I mean, looking at both you and Dr. Trong, I think were just unbelievable examples. Just cities on a hill as far as people to look at it and get a chance to see again. Furthermore, how you can pour yourself into a job and make it part of your lifeblood. So I think that was really a big part for me. Obviously, I've had other people in my life. I've had, a lot of experiences through high school and, athletics and things like that I think taught me probably other skill sets that made me successful.
Yeah.
But as far as like people that I could look up to and be like, this is how I want to look like something like this when I get to the end goal and finally get to treat a patient. I have had, the things in spades. I've been so lucky about that.
Yeah, of course, I have two generations of my life in Panama, and the people that were my dad's generation. My teachers in school, I have several that were important mentors to me. When I was in the internships in Panama, some of the programs that interested me, so I became friends with neurosurgeons and obstetricians and so forth, and they all had something they contributed to my thinking, to my being. But in Panama, by far the most immense influence was from the rural doctors.
Yeah.
That was a special feeling to be in a small town. Everybody knows you and people respect you, and day one you're operating on this person, day two you're at the river together swimming. It's that kind of experience is really special for me.
Yeah.
The 1 year that I did there, and then in coming here, all of the faculty at OU was just incredible people. Dr. Span, Dr. Crawford, who you know very well. They were terrific mentors and terrific role models. And then, of course, Neil was my residency director, or
Right.
almost my residency director at the very end. And then my director at Great Plains. He was a tremendous asset to my education, to my life. And we didn't think alike politically or
Right.
philosophically,
Right.
boss, but I respected so much his intelligence and his ability to educate and all that. So all of those have been incredible mentors to me.
I was completely remiss to similarly mention Dr. Clemenson. I apologize.
Yeah.
That was-
Well, Well, thank you for that. Okay, we've got a few minutes, so we're going to wrap up with the speed round, the lightning round.
Oh,
Okay? All right, who gives better medical advice?
Tomás.
That's pretty easy.
Tomás Owens. Full stop.
Who's more competitive?
Oh.
Oh,
Depends on the day.
That's
right.
No,
No,
deadly.
For sure. All right, last question here. If you had to describe each other in 3 words, what would they be? So I'll give you a minute here, and we'll start with you, Thomas.
Okay.
So if you had to describe your dad as a physician in 3 words, what 3 words would you use?
I would say comprehensive, dedicated, and empathetic.
Outstanding. And Tomas, how would you describe your son as a physician?
Thoughtful, caring, giving, and handsome.
Strike that last one.
Never could follow the
That's
rules.
right. That's right. That's a pre-existing problem.
3.5.
Well, gentlemen, thanks again for spending some time with us and letting our listeners and viewers have a chance to get to know you both better. Dr. Vidala, wonderful.
Always a
working
pleasure,
with you
sir.
again. As always, the listeners and the viewers, thanks for joining us. We'll see you next time on another episode of Fast Talks with Family Docs.
Thank you for joining us today. The doctors would like to see you back for another check-in. Please choose to follow our podcast, and you will automatically be notified when it's time for your next appointment.